Thank you. That is a very heavy CV. I'm not sure whether I am up to the game, but first and foremost, I want to say that I am so impressed to be here today just to share my experience in the implementation of several programs in relation to youth voices. Maybe I'll start with a story because one thing, the interest for the youth, it has to come with an experience. True or false? Looking at myself, for me to be a champion for youth, I must have an experience. And the experience I have is at one time I was working in a health facility. By then I was not a reproductive health specialist, I was a HIV specialist. And this mother who came with an adolescent in the facility, I was the clinician by then. And as she gave the history and I was taking the history from the mother, she had this adolescent girl who was like 13 years. And the story she gave is that I've moved from facilities to facilities, private facilities, faith-based, and now I have opted to come to a public facility. Then the next question I asked her, why would you choose to come to a public facility? And yet, private facilities, I still know they do, because she was at that high level, she was going to a Nairobi Hospital in Isha, and she couldn't get a solution. And now she comes to a health center. So as I was taking the history, how she has moved with this girl from the age of 9 years, and now she wanted some investigations to be done. The first thing I asked her, because the girl came with a persistent wound on the leg. And when I examined the wound, I could feel this is something chronic. So I thought of doing a blood sugar, just to rule out diabetes. Then all of a sudden I thought, why don't I do a HIV test? Then when I went and did there, and I told the lady what I want to do, I want to do a full hemogram. We will also take a swab from the wound. Then I want to do random blood sugar. And because I want to know if it's a bacterial infection, I want to get the treatment which I can give. But I also told her, allow me to do a HIV test. I don't know if it is okay with you, but I want you to take the test, you and the girl. And she then said, why not? All the rest of the investigations were negative, apart from the HIV test, which came out positive. At that time, you can imagine how the situation was, or the two of them were so devastated. But the girl looked very, very strong, but with a lot of anger. The lady was just crying. She couldn't understand how and why. And this was the firstborn, and she had other two children who were behind the girl. So as we continued talking, to cut the story short, she told me, I asked her about the spouse, and nowadays we don't call them husbands, we call them spouses. If you didn't know. So I asked her about the spouse, then I just asked her about the lifestyle of the spouse, and she told me, yeah, true. Sometimes my spouse can walk in, go to the bedroom. Every time we go to bed, he carries some water. You know, now it starts raising some suspicion. So why carry water at night? So he was going to swap some drugs. And at a certain time of the night, he could wake up and drink the water. I can't go to details of the time because you know how HIV drugs are taken. And that's where now the story came. And I think that is when we were still talking, because the girl was there, I think that's where the anger was coming from. So I was interested to follow the case because I was not a HIV penetration, so I needed to refer this girl to HIV penetration, where we had a program where we were following the children, and but I managed to follow the. So at that time now, the anger of the girl continued, and she could face the father. And that time the disclosure was at me. We were doing disclosure, I think, at 16 years. So she's already 13. she has 3 years to continue with this anger, and she has already known she's HIV positive. So I requested the mother to bring the other children. Fortunately, the other children were not. So it is girl. To cut the story short, that's the time I started gaining interest on how do we start dealing with these adolescents, because I could see a family separating because of a child. And from that time, I started getting an interest in the adolescents, young adults, and I started looking at programs where I can be involved in their work and just to understand what can we do. As we talk now, you have heard they are saying that I sit in the policy for the national government, and currently we are doing the adolescent youth policy. And I wouldn't talk for the government. We are still waiting for the outcome, but I would advise you, during the time of validation, I would want you to come in big numbers. We validate that policy together with you, because it is your voices which are in that policy. So back to my presentation. I know it is a very short presentation. I'm working for Population Services of Kenya, where we have a very vibrant RH program and other programs. And our main one is strengthening the health service delivery, both at public, private, and the faith-based. And here we're looking in terms of quality service delivery. So we have a huge programs that covers that. We also do a lot of social behavior change. And this social behavior change for PS Kenya, we have the model that we call human-centered design, where we want to implement a program even for the youth. Our approach is the human-centered design, which I'm going to talk about it maybe in the next, in another slide. Then we also do a lot of health system strengthening, and also that's where I sit, because I want to see the policies, guidelines, and strategies that are being implemented even in the country, working together with the Ministry of Health. They are up to date and they speak up to the what you call the ground. We do a lot of private sector. Maybe most of you who follow the PS Kenya website, you have seen facilities, Branded Tunza, DESIP, and those are our private sector facilities where we work closely with them, just to make sure that the health service delivery and the social behavior change and the strengthening are up to date. We also have a program that runs economic empowerment for the youth, and I will talk about that. It's called Amplified A360. We also do a bit of social marketing, where our Tunza facilities, we support them to get equipment as a low price, and I know most of you have visited our booths. We do the trust condoms, we have a lot of merchandise that we sell. We also have a component on social inclusion. And this social inclusion is where we deal with persons with disability. And we have a huge program that covers that. And we also look at those vulnerable adolescents and youth, just to be included in what we do. And we have a lot of digital work that we do. All what we implement as an organization, we try to see that the digital part of it, what can be done digitally rather than manually, we make sure that we implement that. So this is our program portfolio. We have a GBV program and an gender-based violence, and we also have a sexual reproductive health program. And there we have 3 programs. One is Accelerate, one is Accelerate, and Accelerate cuts across GBV and sexual reproductive health. We have Amplified A360. That one is a purely an adolescent program and youth program. And then we have the DESIP, that is Delivering Equitable and Sustainable Inclusive Family Planning in Kenya. And I will talk to each program as we move on. Then we have another program which responds to COVID. And this is funded by David and Brackett Foundation. And what we do most here is just to come up with messages for behavior change, and we also do a bit of prevention control, where we do provide hand washing equipment, tanks to store water. Then we have another program that is for TB, that is the TB Reach, working in 2 counties, and that program I will also talk about. Then we have the strengthening HIV self-testing in the private sector, and we also have a small malaria program funded by Global Fund, which works in 1 county at the community level. So DESIP, as I've said, it's an acronym. We have been working in 18 counties, but currently we are in 12 counties. And this is a UK funded program. For 5 years, the program started in 2019. We're almost in our tail end. And we work both in public, private, and faith-based facilities. DESIP focuses on women of reproductive age with a lens of eye focusing on adolescents, poor rural women who is living under $1, below $1, and people with disability or persons with disability. And here our main goal is to ensure that women and girls can safely plan for their pregnancies, improve their sexual reproductive health, both the young, the rural, and also the marginalized. So basically, we are looking at health timing and spacing of children, especially to one of the organizations we're working, that is the Faith Religious, and we have an impact of reducing maternal mortality, newborn and child mortality, and also increasing our modern contraceptive prevalence rate in the country. I don't know whether you know where we are right now, but we are 54%. So we have 7 implementing partners. PS Kenya is the prime. So we are the one who coordinated the project. And for implementing partners who do a service delivery work, we have Population Services of Kenya, we have Health Rights International, or Health Rights Kenya, we have a Faith to Action network, and we have AMREF, where we are sitting. The Kenya office, we have an implementing program there. Then for health system strengthening, we work with the Voluntary Services of Kenya, where they focus more on social inclusion, and we have PSI that does most of our research, and options consultancy, where they make sure that the commodities and the guidelines at the national level are up to date. That's DESIP. If you have any question, feel free to ask me where we are implementing. Where in those counties, those first counties where we have Mandera, Wajir, Marsabit, Isiolo, Samburu, West Pokot, Elgeyo Marakwet, those are our areas. And you know how teen pregnancy there is. Accelerate focuses on the 3 zeros. Who knows the 3 zeros? ICPD 25. It was here the other day. ICPD 25. Because that is the one that brought birth to this program. 0, unmet need of family planning. 0, maternal mortality. 0, GBV and harmful practices. Thank you. See, I've taught you today. Yes. Professor, the 3 zeros, ICPD 25. So it's also a consortium. And PS Kenya again here is the prime, so you can know we are a big organization, isn't it? Yes. So PS Kenya serves as the project prime recipient, and the overall for the program is to manage the grants, performance and reporting. We also take lead in implementation of the SRH issues and other issues looking at the implementation of the quality framework. We have the Gender Violence Rescue Center, that is like in the Nairobi hospitals. You know them? Nairobi Women's Hospital. And these ones, they take lead in designing and implementation of gender-based violence activities, interventions, prevention, response, and also the medical legal intervention. So basically here we work very closely with GBRC just to make sure in case of a GBV case in the countries where we implement, the cases are taken care of. Then we have the PSI, that is the Population Services International, and they take lead with our running agenda. In all our implementation, the program must have a running agenda because we can't be there full time. We want to run what can be scaled up to the other counties. So they also inform us of research. About Amplified A360, this is a program, I think it's pure for adolescents. And this program is working in Kenya, Ethiopia, and Nigeria. It's a Children Investment Fund Foundation, that is C. They work closely with the government systems, and this is simply because we are looking at scaling up and sustainability model, because a project will not be there for a lifetime. Most of our projects are 5-year funded. So the design we use is the human-centered design process, where the heart of this ICT process is you put the heart of the programmer to the end user of that product. So you bring the team together, you look at what inspirations are there, what are some of the challenges, then you do ideology with them, then you come close and start thinking what next, what inspires you, who is your mentor, what you do want to be, then you start implementation. So using this, it's an adaptive implementation, it is a continuous learning. We don't say what we start with is what we continue with, so it's a learning process. And it combines SRH orientation and does agency with life skills. We take them to colleges. Once they come on board, we give them a holistic approach. In terms of reproductive health information, if you want to access service, and we also give you a livelihood program. You can be taken to colleges, they are called TVET colleges. You graduate and you can have your small income through that. So this meaningful engagement is the central to our approach, and as I have said, it's not just about the design, we run it throughout, and we are focusing on 15 to 19-year-olds. You know how the Children's Act is, the policy is. So basically we have of the interventions targeted out-of-school girls who are married together with their husbands, and they may or may not have children. So we really do not want to focus those girls who are already in school and they are not married and they don't have children because of the policy issues around that. So this is what they do, and next. Strengthening HIV self-testing in the private sector. Basically, this is a program that we are running in Kisumu, and what we focus on is increasing access points of purchase of position of pharmacy. Just to make sure, using the Ministry of Health guidelines, people can do self-testing, because at the end of it all, if you are not sick, why should you go to hospital for just a testing of HIV? Why can't you do it at home? So basically, we want to improve access to an uptake of HIV self-testing and HIV prevention, and also they will do a bit of giving information when it comes to SRH, because we know HIV, almost 90% of it is a sexually transmitted infection. Then it also implements improved linkages to HIV prevention, SRH, and also issues of confirmatory tests, and other starting of ARTs. It helps with that, because at the time for the youth to get to encourage and meet, our facilities open 8 to 2. Our facilities open 8 to 5. Sindio? Asijana mulisema hakuna pesa ya kwenda kulipa. So we want to do this thing free. And free can only be done where? In public. And public opens 8 to 5. So if you can do that self-testing, it will be very good, and once you know about it, you can also go and get the treatment done. I said this one, it's more or less like, we usually, I would say it is a project that, it's like a CSO project for PS Kenya, because ours is to advocate for finances and we support those facilities in those hard-to-reach areas. We just do a map out and look at that facility where we need to support them in terms of COVID response. And this one we did more in those far-fetched counties, that is Akina Mandela, Wajir, Garissa, Lamu, where we felt, even for the government, it was very hard for them to reach this area. Because they really felt those facilities as in many cases of COVID, but still they needed the prevention. So this is it's funded by Unilever, and it aims to support MOH improve adherence to COVID-19 prevention guidelines, vaccination and the priority population. Our key strategies is coming up with messages that can be disseminated through the mass media, coming up with digital messages that you can get them through your phone, and also out-of-house advertisements. I know you have been seeing Boda riders, most of the kiosk, bus stations, with this kind of photos, Chandwa, those things. I think PS Kenya has been on the front line. And also looking at the infection prevention control, both in Nairobi, Kiambu, Kilifi, and Mombasa, but how far for the distribution of most of the things we didn't manage to go out of Nairobi. So both in collaboration with PSN and MOH, we have been working very closely to come up with WhatsApp chatbots, in partnership with the MOH, just to see how people can hear their issues. Digital vaccine locator tool, just to know how the vaccination is going on. And then the interrupted voice response, interrupted voice response where you can talk and just get your answers. You can ask your questions and your answers are done there. We've also been in the forefront of looking at how best we can do capacity building in terms of behavior change. In terms of coming up with WhatsApp trainings, and where most of the healthcare providers can earn their CBD points through their bodies. And this is because training has become so very costly that you would want to look at a cost-effective way of those kind of trainings. And we have several of them. And if you visit our website, you can also see the trainings that you can take, and you get a certificate. So, and also we will support also on the wash commodities. So, our program for TB, we are in wave 9, and the project goal basically here is to optimize the quality of care for optimal adherence to drug-resistant TB. And here we look at the MDR, multiple drug-resistant TB. That is what we do, and we are looking at 2 counties which have got a very high burden of drug-resistant TB, that is Nairobi and Mombasa. That's where we are in. So we look at strengthening appointment management for these cases, and coming up with a buddy system, either a family member or a healthcare provider or even a counselor who moves with you for all the months that you're supposed to take the treatment, so that you can manage to finish the treatment. You know how expensive it is to treat one MDR case. I think it's almost 2.4 million for one case. So as a country, it's very, very important. We look at how to support the drug-resistant cases. The last one is the Global Fund Malaria. This is a community case management. Malaria is working in Busia County. For most of us, we know Busia it's a pandemic area for malaria. And basically, we train the CHPs to test at the community, and if possible, they have complicated malaria. And basically, they can give the treatment on the ground rather than this is a way of decongesting the hospitals. And the program is also being implemented as a school health program in the coast region. And here you link the school health program to a facility for support supervision, just to make sure that the testing is being done well. And also the CHPs, the community health volunteers, are linked to the facility, and just to make sure that the data, in whatever they are doing, it's managing to get its way to the KHIS, so that the country can program for most of these programs. That is a snapshot of population services of Kenya. We have a lot of youth programs with us, and we do recruit a good number of youths. Either you can come as a volunteer, you can come as an intern, and you end up being employed. Our 2 officers there, they can tell you, they started as volunteers, they became interns, now they're employed by the organization. And it all depends on how you do your work. Thank you so much. Visit our booth outside there. They have all the information. In case of any question, you can reach out to me. Thank you.
A round of applause for her. Thank you so much, Grace. So right about now we'll have an abstract presentation.